Healthcare. Do you support subsidies for the Affordable Care Act or cash-style payments to help foot the costs of healthcare? What's your solution?
Well, I support Medicare for all. It should be a phased-in process where these huge, bloated insurance companies, they slowly trim away, as quickly as they can. They've got to trim away wasteful programs and trim away especially policies that deny people coverage. There's a lot of things. I worked in health insurance briefly, about a year, and I worked in health insurance for about a year, and you could see the ways that health insurance companies denied people coverage. If you didn't get a referral, if you didn't get an authorization, if somebody was out of network, suddenly it's not covered at all. Nothing is covered. And so that kind of policy from insurance companies has to change. So yeah, after time, Medicare for all could be implemented, and you'd still have things like Medicare Advantage and Medigap that insurance companies could offer. We could still have a robust Medicaid program. Insurance companies could do something to help with that as well.
So right now our president is suing our country for $10 billion. And I think the ACA extensions would be something between 25 and 30 billion. And so, okay, there's 10 billion right there for extensions. I think that we'll say the ACA extensions are a Band-Aid. There needs to be some kind of major reform. A one-time payment is a slap in the face, and I think here's some money, go figure this out yourself, right? And I don't know if you've tried to get health insurance recently. It ain't a walk in the park, you know. And so number one, when we talk about health insurance being accessible, and one of a major part of that is that you can navigate the health insurance pathway. Because the average person, I have a PhD, and I have a hard time navigating that pathway. So I think that's something that needs to be fixed. It needs to be not some kind of 30-minute ordeal. It should be something that is, or longer. It should be something that just is, yeah, I like this. I'm going to do that.
Do you think we should have some form of nationalized healthcare or Medicare for all?
I do believe that, and I believe there are sort of ways we can study that and make that happen. I think it shouldn't. So right now there's something like 21 medical doctors in Congress, and I would have thought they would have figured it out. There's only one scientist in Congress, so I think adding another scientist could help. And so these are problems that are solvable problems, and again, but it feels like these are things that are like, well, if we solve that, what are we going to run on, and which is sad for the American people.
The subsidies that just got taken away in this last back in December or November, whenever that was. The subsidies are a Band-Aid. Nobody loves the subsidies. It's a giveaway to a lot of big insurance companies. But in the short term, we need those subsidies in place because it's hurting so many working families all over Western North Carolina. And so, yes, we need the subsidies in the short term. We also need to shore up rural hospitals. I kind of think of those two issues as like the house is on fire, and we've got to solve those issues as quickly as possible so working folks don't get buried or lose their insurance and have no coverage. And healthcare is the #1 cause of bankruptcy in this country. That's terrible, and we can do better than that. And so I think that the long term, we need a comprehensive healthcare system in this country that covers everybody, and everybody has access to decent care. People aren't afraid to go to the doctor because they're sick and they're worried about the cost of it. Our rural hospital, we have good, strong network of rural hospitals all over the place. We have prescription drugs. When you get a prescription and you have to go to the pharmacy, And you got to, you know, it can be $5, it can be $500. We just don't know. And so for so many families, these are really big issues that affect people. And so to me, we need a comprehensive program for healthcare that really solves all these problems. And it's frustrating to see our inability as a democracy to tackle these in meaningful ways, and for our healthcare to continue to go down as opposed to improve, and our outcomes continue to go down. This isn't working for the people of America, and to me, that's irresponsible leadership that we have right now that's creating that outcome. We know that when people have access to primary care, they know and trust their doctor, they're gonna do better. And so we know what winning looks like. We just need to build the path to go get that.
And you think you can be a part of that?
Absolutely, yeah. I mean, I think that's one of the reasons that I decided to run for Congress is I like big, hard problems. I like working with other people. I like earning people's trust to be earnest in our desire to solve these big, hard problems. And so I look forward to working with whoever is earnest about really tackling these big issues in our country to make life better for working Americans.
So of course I support ACA subsidies, but let me be clear, Charles. That is a Band-Aid on a patient that is hemorrhaging. This system of healthcare in this country needs to be fixed once and for all. I've seen too many patients come in asking for help, asking for my care, who don't have health insurance. They can't afford the things that they need. The work that I did in a community health center here in Western North Carolina got them affordable medications, got them, almost, no payment access to health care. We can do this. Right now, this country spends over $5 trillion on health care. That's more than twice what any other wealthy, comparable country in this world spends. And when we look at our outcomes, when you look at just a simple thing like how long do we live compared to other nations, we're 48th on that list. Since when is it acceptable for Americans to spend way more and get less? It is time for us to have a national health plan. I am for a Medicare for All program. We have enough money in this country right now. We're spending twice as much. We have $2.5 trillion to work with to get the other 25 million people who are uninsured in this country. I received a text just yesterday from my daughter. She's 28. She was on our health insurance until she was 26. She had the ACA subsidies through that, and she texted me. And you know what the text said, Charles? It said, "Wish me luck. I'm without insurance." You know why she was out of insurance? It was going to cost her $8,000 to pay for health insurance and a $10,000 deductible. We're talking $20,000 of health care before you actually even get health care. The system needs to be fixed. We need to relieve the burden of lack of health care on the American working families.
Are you willing to fight for that?
Absolutely. I've been fighting for that my whole life, whether I'm taking care of patients in the exam room or whether I've been leading a community health center that more than tripled the number of patients who have access to health care because of what we've done. Over 80,000 patients have this. Quadrupled the number of providers taking care of patients in Western North Carolina, in our rural counties in Western North Carolina.
So 69% of the world population has universal health care. We spend about $2,000 more per person than the next country, which is Switzerland. If we look at healthcare as an industry, it doesn't really add anything to the equation. It doesn't make access easier. It doesn't reduce costs. It doesn't reduce the burden on the people. Its sole purpose is to make money. And there are certain industries that the people of Western North Carolina do not want to see profiting on people's suffering, and that is healthcare. I think that what we need to do, and one of the things that I've been doing, is doing a systematic review and meta-analysis of the universal healthcare options in other countries. See if we can figure out exactly what we can use, what we can't use, and then bring that legislation and that information to Congress so that way we can get universal health care, Medicare for all, what have you, which ultimately is cheaper than what the American people are having to slog through right now.